Good morning and welcome to our fourth year summit and second day program. My name is Kayvon Freeman. I am registered nurse, care services coordinator for ALS United. Today our session is nutrition and ALS. Before I introduce our speaker, I just want to ask you that you can put your questions or a statement on the chat or question answer, and we try to get to all of it as time permits. Our speaker today is Danna Raphael. It's my pleasure to introduce her. She's a registered dietitian with 15 years of medical nutrition experience. She's been working with diverse patients population in a variety of settings, including oncology, critical care, and liver transplant, as well as general nutrition for the patient. Currently, Danna is inpatient dietitian at Hospital for Special Surgery, and also she's our dietitian at ALS clinic at Hospital for Special Surgery. Thank you, Danna. Floor is yours.
Thank you so much for having me. I'm going to go ahead and share my screen. Okay. There we go. Okay. So today I'll be talking about nutrition and ALS. I'll be touching on general healthy nutrition, some specialized diets, some diet modifications, and then moving on to nutrition support. Nutrition is important for those living with ALS to meet increased energy needs caused by ALS, slow the process of muscle breakdown with ALS, keep the immune system strong, maximize energy levels, and improve the sense of well-being and quality of life. Touching on some general nutrition recommendations, compromised nutrition leading to weight loss is a common and significant problem in the ALS population. Poor oral intake and subsequent weight loss is a significant negative prognostic indicator of survival. A general healthy diet that is recommended is something like the Mediterranean diet, fruits, vegetables, whole grains, lean proteins, and healthy fats. So fruits and vegetables are chock full of vitamins and minerals that are essential in helping the body function its best. Consuming a wide variety with different colors can help you obtain different nutrients. They don't say eat the rainbow for nothing. And fresh, frozen, or canned are all good options. Whole grains are a good source of energy and provide a good amount of fiber. Some examples would be like whole wheat bread, brown and wild rice, quinoa, oats, farro. As far as proteins go, choosing high quality proteins such as eggs, poultry, fish, and meats like beef, veal, lamb, pork. Beans, soy, nuts, and seeds are a good source of plant-based protein as well as high in fiber. And fiber is important for keeping your gut moving, as constipation can be an issue. Choose the unsalted nuts and seeds and their butters like peanut butter, almond butter, cashew butter. They make all kinds of butters now. I've recently seen watermelon seed butter. Dried beans and legumes are preferred. If you are using canned, that's obviously fine. Just try and choose the lower sodium option and make sure to rinse and drain them before using. Soy products like tofu, tempeh, and edamame are also great sources of plant-based protein. If you are eating more plant-based proteins, make sure you're consuming some kind of vitamin C like citrus or berries. This is a good way to increase the absorption of iron from those foods. Next, I would like to highlight the importance of fat in the diet. Fats supply calories, they help you absorb certain vitamins and provide essential nutrients that your body needs to function. Monounsaturated and polyunsaturated fats are considered the healthy fats. Monounsaturated fats are found in oils like olive oil, peanut oil, or canola oil. They are found highest in the nuts, almonds, hazelnuts, and pecans, and in seeds like pumpkin and sesame seeds. There are two major classes of polyunsaturated fats, the omega-3 and omega-6 fatty acids. These are essential fatty acids, meaning your body cannot make them and you must obtain them through food. Some good sources of omega-3 fatty acids include avocados, flax seeds, chia seeds, nuts like walnuts and pecans, hemp hearts, and in oils like canola oil and walnut and flaxseed oil. The fish that are highest in omega-3s and lowest in mercury include salmon, mackerel, anchovies, sardines, and herring. Omega-6 fats, which we get mainly from vegetable oils, are also beneficial, but these fats don't really enjoy the same reputation as the omega-3 fatty acids. The main charge against omega-6 fats is that the body convert them, one of the most common ones, which is linolenic acid, into another fatty acid called arachidonic acid, and this one can, in large enough quantities, can promote inflammation. So there is an argument to cutting back on eating a diet highest in omega-6 to improve the ratio between omega-3s and omega-6 fatty acids. The American Heart Association put out a science advisory that was 2 years in the making and included 9 independent researchers from around the country. And the data revealed that there are cardiovascular benefits in eating the omega-6 fats. Just the balance is key. So we can't talk about fat without talking about the ketogenic diet. Ketogenesis is the production of ketones. Ketone bodies are produced from fat when glucose availability is limited. And while the liver is the main site for ketogenesis, glial cells, which are found in the central nervous system, are also able to produce ketone bodies. This can occur not only by following the typical ketogenic diet, but also alongside a Mediterranean diet with adaptations such as foods rich in medium chain triglycerides, or MCT. The main difference between MCT versus regular fat is that MCT is a shorter chain, and so the way it's digested, absorbed, transported, and metabolized are different, and the MCTs produce more ketones than regular fat. So the composition of a typical ketogenic diet are mainly non-starchy vegetables, butter, eggs, avocados, nuts, and seeds. And the risk associated with a true ketogenic diet is weight loss, which we don't want that to happen, and alongside some other side effects like diarrhea, which also is not that pleasant. And again, we know that weight loss can accelerate progression. The Mediterranean diet has many characteristics of the ketogenic diet, like being rich in olive oil, eggs, vegetables, nuts, and seeds. These foods do provide high amounts of ketone bodies. The Mediterranean can be, increased to produce more ketone bodies without being the typical ketogenic diet by just consuming more MCT fats like coconut oil or goat's milk or butter. And the Mediterranean diet presents great benefits to treat and prevent oxidative stress in most neurodegenerative diseases. So the ketogenic diet was looked at from the lens of possibly improving motor function. So ketone bodies have been shown to improve brain mitochondrial production. Ketone bodies can reduce the glutamine release, which is the same mechanism as xylitol. Keto can reduce biomarkers of inflammation in ALS and boost the production of antioxidants made in the body and reducing oxidative stress. Most of the studies were done in mouse models and unfortunately haven't been able to be translated into human trials. There are 2 human trials looking at the ketogenic diet. One of them was terminated. The reasons were not listed, and the other trial's results are still not posted. There is some exciting news and new research that recently came out from Dr. Ik-J Lee and his team from Columbia. They looked at carbohydrates with different glycemic properties, high versus low glycemic index and high versus low glycemic load. So the glycemic index looks at carbohydrates that break down quickly during digestion, and they are ranked on a scale from 0 to 100, with pure glucose or sugar being given the value of 100. So the higher the food's glycemic index, the higher the blood sugar rises after eating that food. And the glycemic load indicates how rapidly a specific carbohydrate raises the blood sugar by factoring in the actual amount of that particular carbohydrate that's being consumed. So for example, watermelon has a high glycemic index, but a serving size of watermelon actually does not provide a high glycemic load. Potatoes, on the other hand, are considered to be a high glycemic index, and a serving size is also considered to be a high glycemic load, or provide a high glycemic load. So Dr. Lee recently presented these findings at the Northeast ALS Consortium in February. And what was found was a diet with high glycemic index may be associated with slower disease progression in ALS. Lee et al. Study from 2021 looked at fat and lean body mass separately. Lean body mass, which is muscle mass, universally trended down, while fat mass increased in some and decreased in others. Lee et al. Found that fat mass loss was associated with faster disease progression. Another study from South Korea by Choi et al. In 2023 saw that ALS patients with lower visceral fat mass, which is fat around the abdomen, had a shorter survival compared to those with higher fat mass. Those with higher fat mass had a greater than 2-year survival than those with lower fat mass. So in order to understand the mechanism a little bit more, we have to talk about catabolism and anabolism. So when you are in a catabolic state, the body is ready to break down complex molecules and tissues into simpler ones to be used for energy. Hypermetabolism, which is when the metabolism is at an increased rate, is consistently observed in ALS. And so when you don't have enough energy, after burning through your glucose stores, your body moves to break down your muscle mass. In an anabolic state is when the body is building complex molecules and tissues. So when you have a rise in glucose after eating high glycemic index food, this triggers insulin secretion, which is a key switch that turns on the anabolic state. So insulin targets the insulin receptors in your muscle tissue, and that helps glucose enter the cells. So think of insulin as the key that opens the door for the glucose to come in. And so this leads to cell proliferation. A high rise of glucose and insulin may benefit ALS patients by switching on that anabolic state. A lower glycemic index diet and ALS can lead to more catabolism, weight loss, and a lower BMI, which are all risk factors for faster disease progression. Again, ALS patients are hypermetabolic, their muscle and spinal neurons are hypermetabolic, glucose demand increases, and so we do need to keep up with that demand. So taking a look at the specifics, Dr. Lee and his team examined the nutrition intake and functional decline. In this study, there were 304 participants. The average age was 61 years old. 59% of them were male, and they were enrolled in the study close to diagnosis. So participants progressed as a whole group was linear. but there was less functional decline associated with glycemic index intake. So the specific foods that were examined were the French fry intake, and what was found was that those who ate 2 or more servings of French fries per week had the least decline in their ALS functional rating score. Pasta and mac and cheese had similar results. The frequent consumption group had the lowest declines in the ALS FRS. The higher glycemic index food intake, again, was associated with less functional decline at the 6-month follow-up mark. So, tying back into the omega-6 intake, keep eating those fries because you're getting not only the high glycemic index food, but you're also getting the omega-6 from the oil that they're fried in. So it's typically a soybean oil or a corn oil, which are both high in omega-6 fatty acids. The survival analysis demonstrated that higher glycemic intake was associated with longer survival and slower functional decline. The higher the glycemic load was also associated with less functional decline. So having both a high glycemic food like French fries, pasta, and mac and cheese, but also having like a nice quantity of it to keep those blood sugars higher. So the higher load keeps your glucose level higher for a longer period of time turning on that anabolic state. So other examples of the high glycemic index foods, white and whole wheat bread, white rice, breakfast cereals, cereal bars, granola bars, cookies, cakes, any kind of like ice cream, chips, rice crackers, and fruit, and sweetened yogurts also. And, if you do have other co-occurring conditions like diabetes, your dietitian will work with you how best to balance out your diet in regards to, not having too much blood sugar spikes. So moving on to some dietary modifications, it is generally recommended that you do not try to lose weight once you are diagnosed with ALS, for reasons that we just discussed. The goal is weight maintenance. Even if you are overweight, dieting is not recommended. You may experience minor weight loss due to the reduction of muscle mass. So some tips with helping to maintain your oral intake are to eat well during your up times, consuming smaller, more frequent meals, and trying to avoid going longer than 3 or 4 hours without eating something, keeping easily available snacks around, or some kind of oral nutrition supplement. Oh, sorry, I'm having an issue switching my slide. Oh, there we go. Okay. Understanding that it can be difficult to consume certain foods, there are ways to increase the nutrient density of your meals and snacks without increasing the total volume of what you're trying to consume. If consuming meats are difficult and the idea of having pureed meat doesn't sound appealing, there's other ways to get your protein in. Using nuts and seeds and their butters in smoothies, soups, yogurt, hot cereals, blending peanut butter, almond butter into something hot like oatmeal does make them less sticky and easier to tolerate. And if you're taking whole nuts and putting them in the blender, that also allows for them to be easily consumed. Adding pureed beans or lentils or soy products like tofu into your soups and stews or sauces can also increase the protein. And it doesn't really alter the taste. Like beans are pretty mild, and tofu doesn't really have a taste at all. And so it really does take on the flavor of what you're putting it in. Hummus can add both calories and protein, and yogurt can be added again to hot cereals. You could stir into soup. You can make sauces with it or dips. And so moving on to just some ways to increase the calories of what you're eating, adding healthy fats, again, like nuts and seeds and avocados, olive oil to smoothies or shakes, using plain Greek yogurt or avocado, tahini, which is just, sesame seed paste, or hummus in place of or in addition to mayonnaise for your egg salad, tuna salad, chicken salad, or even a chickpea salad are good options. Using full fat cheese and adding them to sandwiches or mashed potatoes or pasta. I mean, you can really use any cheese you like. The ones listed don't get stringy when they're melted, because I know that that can be a challenge. Use heavier sauces like Alfredo sauce or pesto sauce on meats, sandwiches, pastas, potatoes, uh, choosing more creamy dressings like ranch and Caesar and blue cheese. And you can add that to meat and vegetables and potatoes and, I mean, really anything that you're eating. Uh, Adding extra butter to your hot cereals, your pasta, mashed potatoes, adding extra butter to soup that you're eating or stews, adding extra butter to gravy or extra olive oil to gravy. And then the dessert. So ice cream, pudding, whipped cream, eat those freely. You don't really have to limit them. And again, if you have other concerns like diabetes or heart disease, your dietitian will work with you in the best way to increase your calories without adding too much carbohydrates or fat. So to help manage weight loss, it may be recommended to incorporate a higher calorie, high protein oral supplement like Boost, Ensure, Kate Farms, or using fortifiers like a Carnation Instant Breakfast or Benacalorie in smoothies. And alternative nutrition support by way of a feeding tube is also an option. For those who think they may want one, earlier placement is recommended, even if you're not going to use it right away. It can be used for fluids or medications. For those who know that they don't want one, that's fine too. Your speech therapist and dietitian will work with you and help you eat the safest way possible. So I just wanted to take this time to just talk about a feeding tube placement, since I know, that's not always brought up at every visit, especially if, you are still eating well, but that is still something that, you should ask for or ask about if you are interested in hearing a little bit more about it. I know it can be a scary thing to think about, but the procedure itself is pretty non-invasive. So I have a feeding tube here. This one's a pediatric one, so the cord is a little shorter than the adult size one. So what happens is this part here is what gets placed into the stomach, and there's a balloon at the end that gets inflated, and so it just, this is what's inside the stomach, and then this is the part that is out of the body. And there's different ways that they make like bands that you can tuck it in, or some people just tuck it into their pants or belt or something. And then this is used as regular mealtime, so you can use it in place of meals or in between meals if you are still able to eat a lot by mouth. And this does not take away your ability to eat. If you are still able to, it is recommended to continue eating. You may just need a little extra nutrition at this point. You can use it for medications if those are causing problems, or again, you could just use it for just extra water. If you are going to use it for feeding, it is recommended to use more of a commercialized formula, because these are specially made to go through a feeding tube. They do make regular formulas. They make some specialized formulas that are more like real food blends. So you could talk to your dietitian about your preferences, and we'll work with you on what you want. And, if you don't tolerate one, there's always another one that you could try to make sure that you are tolerating the tube feed well. And, the goal is to maintain your weight. So, when it's time to feed, you open this little port up, and there's a couple of different ways to receive the formula. The first one is a bolus feed. So it comes with a little syringe, and that will get placed inside the port. And in order, you want to make sure the tube is working the right way. So the first thing you do is you put water through it to flush it in, make sure the tube is working, it's clean. And then most formulas come in a carton like this. And this is to replace a meal or a snack. And so the time it takes should be about the time it would take to eat a meal. So like 15 minutes, 20 minutes is recommended. Some people can tolerate it faster, but think about it. This is going directly in your stomach. So if you do it too quickly, you might not feel that great. It would be like chugging a milkshake. And, maybe someone can tolerate it, but I typically recommend going slower to start. So, you flush the water, you open up the carton, you fill up the syringe. The higher you hold it, the quicker it's going to go into your stomach. So trying to hold it a little bit high, not too high, play around with it and see how you feel. So again, taking about 15-20 minutes to give the container. Some people do one at a time, others can do two at a time eventually if they need to. And then afterwards you flush with water again to make sure the tube stays clean. There's a clamp involved to make sure things don't come back out. You clamp it, you take the syringe out, and you're done. So if you are able to do this yourself, or you have a caregiver or family that's able to help you with the syringe feeds, that's how we like to start. If you are having difficulty giving yourself the bolus syringe feeds, there are two other options. Both are requiring a feeding bag. And so this is what a tube feeding bag looks like. And it has a hole on top. And so you pour in the container of formula and you connect that to the end of the feeding tube. And so one of the ways is a what's called a bolus gravity feed. So you're doing one or two containers at a time. You pour the formula in here, you connect it, it gets hung on a pole, and it just kind of drips in, and it might take about 30 minutes or so for it to go in. The other option, if you are, having difficulty tolerating a more bolus type feeding, or if you still want to eat during the day, or if you really can't eat at all and the higher volume feedings are making you feel not great, the bag is also used for just continuous feeds. And so we could do anything from 8-hour feeds to 24-hour feeds. It really just depends on what your preference is, what your tolerance is. There is a situation where you could be fed while you're sleeping. So before bed, you pour, 2 or 3 of the containers in. Your dietitian will calculate the rate that the pump is set at, and it just runs overnight while you're sleeping. And then, when you wake up in the morning, you could still eat during the day. You could also get a continuous feed during the day as well. There's plenty of ways to get you your nutrition and make sure that you are feeling your best. And with that, I think that's it. So thank you for having me. And, Kayvon will let me know what questions you have.
Thank you so much, Dana. That was excellent. I see one question, and basically the person is asking if you could comment on ProStat to add protein and for wound healing.
ProStat?
Yeah.
Oh, sure. Yeah, that's
Yeah.
definitely another supplement option, that can go, you can take it by mouth by mixing it in really any liquid, or it can be put through the feeding tube. You just have to mix it with water and flush it in. And the same thing with if you're taking it by mouth, I would put it in like a different liquid and just drink it that way. Prostat, it's high in protein. There's about 15 grams of protein per 1 ounce packet, or I guess it can come in the big jars as well. There's 100 calories in them, so it is a good option to not only support meeting your needs, but also if you do need a little extra help with wounds healing.
Danna, does insurance pay for it, or they have to pay out of pocket for the Prostat?
For Prostat, I'm not sure. I believe that you do have to pay out of pocket for it.
It's pretty expensive, right?
I'm not sure about. I think, yeah, I mean, I think each bottle might, I actually don't know what the prices are these days, but the containers do last a little bit of time. And that might be something that maybe you don't need to take every day, depending on what your other intake is like. But that's where I would work closely with your dietitian on figuring out what exactly your needs are.
Okay. So another question is they want to know how much the feeding tube technology advanced since 40 years.
I don't know if it's really changed that much. I know that they have recently changed the port itself so it can be more easily connected to either the syringe or the bag. But other than that, I mean, it's really the same. The tube is mostly the same. It goes into the stomach, or it could, if you're having like stomach issues, it can be placed further down in the gut in like the small intestine if needed. But other than that, the technology is pretty much the same.
Okay. Another question is what happens if feeding tube leaks?
Leaks
Layer leaking from the side of this
from the site.
tube, yeah.
I mean, if you find that it's leaking and like the formula is coming out, or even if it's leaking and there's like blood around the area, that would be more of a question or a concern for the GI to take a look at.
Okay. They want to know more about French fries. Is it a good preventive approach, French fries?
I wouldn't say it's a preventive approach, but what Dr. Lee and his team found that eating higher carbohydrate foods or higher foods that have a higher glycemic index turned on your body's state of just building cells and not breaking basically your body down. So eating French fries was found to produce like higher fat mass, which then was associated with a slower disease progression.
Like, what happens if they feel bloated after the feeding tube? Any recommendation for that? Apparently, this person takes about 20 minutes and use eye sources for the formula.
Okay. Yeah, I mean, you can try slowing it down a little bit more and pushing it more to like 30 minutes to feed. I don't know if you're taking 1 container or 2 containers at a time. I mean, if you're taking 2, I would maybe try 1. If you're only taking 1, I know this can be a challenge, but splitting the container up into 2 feeds and doing half and then waiting maybe 15 or 20 minutes and then doing the other half might be an option for you. And, I'm not sure if you're having other GI side effects as well, but, if this is continuing to be a problem and you're really uncomfortable, maybe switching to more of a pump might might work better for you. So it's a lower rate. You're just connected and for a little bit longer of a time frame.
Okay. What are the options for the patients that they do not eat nuts and nut butters and very few vegetables? What else they can do?
Okay. I mean, from nuts and nut butters, I'm not sure if they mean like from an allergy standpoint. But from an allergy standpoint, I mean, sunflower seeds and pumpkin seeds are good options. If it's from a functional standpoint, because they are hard to chew, using the butters are a good option. And if you don't really like them, tahini is a good one. I mean, I know sesame was just recently added to like the top 9 allergies. So again, I'm not sure if this is an allergy thing, but tahini, it's very mild. It has like a little bit of a nutty taste. And if you are able to put it into a smoothie, when it gets blended, it loses that stickiness in the mouth, or the crunch if it's a whole nut. Or you don't need to eat them at all. Using olive oil and avocados are other great ways to get that healthy fat in.
Okay. Actually, the answer about that prostate, apparently it's about $30 for 30 ounce through Amazon, which is,
Okay.
it is a
And a
little
serving
bit.
size is about 1 ounce. So it's
Yeah.
about a 1 month supply. And there might be a way to get it covered. I'm not sure about that though.
Mhm. Okay. So other question is, what happened to the patients that either they're diabetic or they're pre-diabetic and they have to minimize the glycemic food? What should they do?
So I still think that you can eat all of these foods like the French fries and mac and cheese or just pasta. When you pair a higher carbohydrate food with some kind of fat or protein, that does help to reduce the amount of like the breakdown and release of the glucose. So, I think the point of the study was saying like we want a higher glycemic spike, but for those patients who really can't have that, I think even having it at a little bit of an increased level and keeping it within like a safer blood sugar range, I still think would be beneficial.
Okay. All right. So let's see, I think there's one more question came up here. Um, that person said, thank you. Good answer. So now let's go back to the feeding tube that mentioned. When do you recommend patients to go for feeding tube?
So this is something that I like to just mention in the first couple of visits. It may not be the first one. Whether they are having difficulty swallowing and getting enough nutrition in or not, I think it's important that everyone knows their option. And we don't know how someone's going to progress. Someone may not need one at all. But for those who are having more bulbar issues and having difficulty swallowing and are losing weight, this is something that I definitely want to make sure that they know is available and for them to start thinking about it. And just, not encouraging them, but just making sure that they do know that it's not one or the other. It's not feeding tube or taking food by mouth. You can do both.
Okay. So they want to know if you have PEG, then do you have to have a GI doctor?
The GI doctor does place the tube. And typically it's, you follow up with them, I think a couple weeks after PEG placement. And then, if there are any issues, or if you need the tube to be replaced, which I think might happen like, once a year, every 2 years or so, depending on the tube and how it's being cared for. You do need to have someone who's able to look at it and change it if needed.
So it doesn't have to be really GI doctor, somebody uh, internist or someone who can do that.
Yeah, I'm not sure if an
Yes.
internist does
Yeah.
tube
Well,
changes.
in emergency room
An
sometimes.
emergency room, yeah. So if
Right.
your tube does happen to fall out, you should go to the emergency room because the hole can close pretty quickly. So if it were to fall out, which it's not that common, you really have to pull at it for it to come out. You should go to the emergency room to have that cared for.
Okay. So now another question is a fun question. When you are having feeding tube, can you have alcohol in a feeding tube? Can you drink wine or beer?
Um, I mean, I would talk to the doctor first and foremost, making sure that it's not going to really interact with other medications. You can definitely put alcohol through the feeding tube. If you're having, speech issues or swallowing issues or balance issues to begin with, just know that having alcohol can impair them further. So making sure that you have someone with you to help. And, if you're putting it through the feeding tube, it goes in much quicker. And so just, watch how much you are putting in through the tube. But yes, you can put alcohol through the tube. Make sure you are flushing the tube with water pretty well after. We don't want the tube to start to break down from the alcohol, but you can.
And also, I think red wine sometimes causes a stain on the tube too.
Yeah.
So that's
Yes, maybe
another thing.
stick with white wine. Yeah.
Yeah. So,
Or
okay.
margarita.
Oh, yeah, right. So the other question is, does every ALS patient eventually need a tube? And what are the options if they don't want a tube?
So not everyone will need one. It really depends on your progression, and everyone is different. And we're not able to really tell what your progression is going to be. Some people don't ever need one. And even for people who are having difficulty chewing and swallowing and maintaining their nutrition, they can choose not to get a feeding tube. And that's where you'll work with the speech therapist on the team and the dietitian, and we'll come up with ways on how to uh, swallow the safest and how to make sure you're getting enough nutrition in. And that's where maybe some of the oral supplements can come into play, or making your own smoothies at home might be helpful.
Okay, so let's see. The other question is, what about the homemade food? Can we just, because I know in old days that we didn't have all these different kind of formulas and fancy ones and all that. They used to make food and make it like a liquid form and put it in the tube. Are you recommending that?
I don't recommend that, mostly because the formula that's made really is focused on making sure that it's a complete nutrition with vitamins and minerals that your body does need, that there's a certain amount of protein, a certain amount of calories and fat in them. If you don't want to take more of the more like commercialized formulas, which some people don't, and some people don't even tolerate them, they do have formulas now that are real food blends. One of the companies is Real Food Blends. That's the name of their company. And so it's made from real food. It's like chicken or turkey, beef, and sweet potatoes. But the ratios are all kind of figured out and weighed out. Another option is like a functional formularies, and they make the formula from real food. I believe that there's like beans and nuts in it, and it's blended. And the other thing you have to take into consideration is making sure the viscosity of the formula is correct, or you run the risk of clogging the tube. And so that's really why I don't recommend it. We don't want the tube to get clogged, and we also don't want you to have any kind of like micronutrient deficiency that maybe you don't realize is happening if you're making your own food at home.
One question, you did mention about adding oil to smoothies. excuse me, wouldn't it change the taste?
I'm sorry, you said oil?
Yeah, you said you can add olive oil and all that to smoothies.
Yeah, I mean, I wouldn't add like a quarter cup of it, but a couple tablespoons of olive oil, you won't really taste the difference. I mean,
Okay.
it shouldn't really alter the taste.
Okay. Let's see. We have the answer. Somebody just mentioned that it reminded them of when HIV and AIDS started, they wanted them all to get fat and live longer while the disease progressed. So it was just a statement, not basically question for that. So I think all the questions been answered. Thank you so much, Donna. You did a great job. And just to let the audience know that our next session, it's in 2 parts. It starts at 10:45. It's a patient and caregiver recommendation for hospital visit. And the other part of it is in-home care, finding and paying for a caregiver. So hopefully you can join us in that. And with that, we want to thank you all for attending. And thank you, Dana.
Yeah. Thank you, Kayvon. Thanks, everyone.
Thank you. Bye, everyone.